through the cracks in my hands. Tell myself be stronger. My heart's like a rubber band, and it's such a shame. You'll always be the one who got away. We both know that deep down you feel the same. Hard to say it's over, but I'm already someone else's. Baby, let's hit the road. Hey, I'm already someone else's. Wish I met you at another place and time. If only you were mine.
WEFM, the really fresh sound.
WhatsApp us or call us at 457-9997. Activated Mornings on WEFM 99.9 is on now.
All righty, so the time here in SVG, it is 8:46, and we are back with you for another commentary segment here on today's Activated Mornings program. So Doc is in studio with me at this time, and Dianna has left. All right, she had to leave to do our work-related activity. All right, so it's just Doc and myself for the rest of today's program. All right, so Doc, officially, good morning to you.
Good morning. As I was saying earlier, there was some sort of traffic jam somewhere on the Leeward Highway in the Kittels area. And so traffic was being diverted down to Lower Kittels, right? And around to Camden Park and so forth. And I decided, you know what, some quick thing, let me park up the car and walk up the hill and walk over here. I wasn't expecting it, but I'm here, late, but I'm here.
Yeah, well, I figured as much. The rain might have prevented your early arrival because you're coming from the other end, but it's not just the rain, it's
Yes.
Yeah, I think there's a landslide.
There's a landslide somewhere.
There's a landslide somewhere.
That's probably
that in
yes.
traffic talks. So
yes, well, there's
so you're going to be one of those to advocate for another road on the Leeward side? Are you one of those?
Well, listen,
because we only had this one road in Leeward, right?
Yeah, but no, what's needed really, I believe, is that road going over Lowman. So it may not alleviate down in Layu or Barley.
No.
Or it may not alleviate, Camden Park. This area has two roads. That's why we're able to use this coastal road versus the main road. So there's two roads here.
My problem always is, Gibson Corner and Lowman's, something happening across those areas.
Well, that's what I'm talking about.
Right,
I'm talking
where we're
about.
trapped.
So going over Otley Hall, that road, and there are plans and there have been development, but that's the whole thing. How do you get all these things done? Some persons may say, do that before a port, do that before an airport, do that before a hospital.
Or maybe do that before, you consider adding more hotel rooms on the Leeward side.
Adding more hotel rooms on the Leeward side?
Or before more hotel rooms are added on the Leeward side.
No, remember, hotel rooms are predominantly private sector investment.
Correct. Okay, so work in conjunction with have them along
what happened that took place. I want to applaud James Mitchell. We used to have the road going along Mount Wayne, along the coastal road, going down to Peters Hope. And they built a new road going over in a different direction so as to facilitate hotel development in and now you're going to see the Marriott Hotel starting this year. But I understand what you're saying. You're saying forget the Marriott and build a road.
You just put words in my mouth. Which part of me say forget Marriott? Which part of me would say that?
No, how I'm saying, I thought you said
in conjunction with. While we are doing these developments, do it in conjunction with.
No. I thought I heard you say do it before the hotels
Okay,
You
maybe I
do the
did say
road.
before, but I'm not saying to
sorry,
scrap it all
misinterpreted.
together. I'm not saying to scrap it
my
all
hair,
together.
my hearing is a little funny. That's what I heard, and I want to apologize if that wasn't what you really
It was
meant to say.
Correct.
You know,
correct.
I should have interpreted what you really. You wanted to say both should be done at the same time. So when you get money for a hotel, you get money for roads elsewhere. Because I'm saying to you, they did a road for the Marriott. So to facilitate the Marriott. But what you're saying is that before the Marriott, they should build roads elsewhere. You know?
Because we are having a lot more hotel rooms on the leeward side, we cannot all be facing this congestion
guess what?
between Gibson Corner and Lomans.
I understand what you're saying.
Because there is no alternative
Before
road.
any hotel is built,
we could do it in conjunction with. That's why you saw.
No, because I'm interpreting what you're saying. You see, it isn't that there is one. The hotel development is also going to bring the economic benefits and earnings as well.
Not saying no, and clearly I won't say to scrap them either.
Yes, to help pay for the new roads. To say we have to have two things at the same time and so forth.
Why not?
You know, it's where.
Why not?
So yes, you are getting road development for the Marriott, but I'm interpreting you're saying that also road development at Lomans and so forth before the Marriott.
To help to alleviate, because we already have Sandals Resort down there. What we want for a dignitary to be trapped
and you know
along Gibson Corner because you're waiting for a container that has overturned or a vehicular accident.
Yes.
That what we want?
The containers ain't just coming from Marriott. Remember this Camden Park
it's port, but
so
I mean
port development.
Port, and not talking about Marriott.
Right. So that's why we have a new container port that is going to facilitate that. Oh my gosh, the infrastructure development. You know, anyway.
Somebody call it. You want to take the call?
I was going to talk about something this morning, but let's take the call. Let's take the call.
Morning, Jeff.
Good morning, Doc and his lone angel.
I know, right? Who he's trying to stress out on this morning.
Yeah, but you know what? Doc, I've got to stress you out, Roleza. Because that is what you said it on.
I know, but it wasn't what I meant. And Doc knows better.
But listen, I still apologize. I still apologize for not knowing what she really wanted to say. Let me apologize.
Now, sometimes you have amnesia what he says sometimes.
Jeff, no, do not go down that road. Do not go down that road.
Only sometimes.
I know where you're going with this. Do not go down that road.
I've heard it once or twice, Jeff. I've heard it once or twice. But
Hey, Doc, I wanted to get you last week, man, with that problem we had, I believe, in New Jersey, when you were stopped by the cop and held up for quite some time. I was honestly surprised that with the diplomatic thing that you have, that would not exempt you from that, you know?
No, well,
I really
no. But tell me, this is the way it happened. It isn't that I had a diplomatic plate in the car. It isn't that I had a flag or we have those sort of things. I handed him the diplomatic passport, and when he saw it, I saw his eyes opened as if, oh boy, I have touched on something I should not have. So he went back in the car, and I think he was checking it out. Maybe.
To make sure.
Maybe. Because it was St. Vincent de Grenadines, he didn't know where St. Vincent de Grenadines is. He was looking up where St. Vincent de Grenadines is, and if there was such a country, it was a forged passport or so. But he came back and he had me say, all he said is apologize and say, get on your way. I'm sure you're gonna make it to the airport. I'm sure you're gonna make your flight. You know, so
I know what you're talking about because
I felt vindicated. Just like when Roleza this morning, I feel vindicated.
That me even studying you again.
Yeah. But you know, I tell you, I've been driving for so long.
Yeah.
You know, I've only had one traffic violation in my life.
Yes.
All the time I drove in England and America.
Yeah.
One traffic violation in my life.
You're lucky.
I didn't get no points or nothing.
You're lucky.
See what happened? When the police stopped me, I give them the English way. I give them the courtesy. The courtesy.
Yeah.
And they love that. They love that.
Yeah.
And they say, just have a good day. And I say, you too.
All right.
And it's done. All right. Keep on chucking it, Joe.
All right.
Keep on chucking on.
All right. Have a good one, Jeff. All right.
In 6 minutes, I want to just touch on something I normally touch on a Wednesday night. Joe Biden has been diagnosed with aggressive prostate cancer. But I'm not talking about Joe Biden. I want everybody to know that prostate cancer is the most common cause of cancer today in St. Vincent and the Grenadines. It overtook breast cancer, which is a cancer that occurs in predominantly women. Do you know breast cancer can occur in men as well? It's not common, right? Less than 1% of breast cancers occur in men. But, of course, prostate cancers don't occur in women. And black men in the United States and in England, both places account for 30% of the cancers of the prostate. And even though the population of black men may only be 10, 12, 13%, this is significant. It's not just related to the type of care that they seek and the lack of care that they seek, but that there's definitely a greater incident among black men and among younger black men, and that it is a more aggressive type of cancer. There are many different types of cancer. I want to tell you the prostate cancer has some glands in it that secretes a fluid to help the sperm survive and to be part of what we call the ejaculation. You know, those glands are up against the rectum and also sometimes against the gland, the tube that passes through the prostate. That's why when these cancers, but they come from a night. But there are some other cancers, and I'm going to say this is the last thing. Consider a prostate to be like a beckwith plum, a red beckwith plum. And when you bite into the beckwith plum, you see that yellow stuff. I'm not talking about the seed. I'm talking about the juicy stuff around the seed. Well, the cancers, 90+% of the cancers occur inside there. A few of the cancers occur in the red skin itself, in the red skin or just beneath that red skin. And that's why they're more aggressive. They spread quicker. And so I want to alert men that getting checked early, right? Detecting these things early is of critical importance, because if you have an aggressive cancer and it's past what we call stage 4, where it start to spread already, it will start to spread to the rectum, start to spread to the bone, there's still a chance that you could receive treatment and it can be controlled, but there's a great chance that it may lead to death. So the highest death rate we are seeing is among black men, because they're not picking it up early and because they seem to be at a greater increased risk. And if you're a brother of somebody with prostate cancer, if you are a brother of a woman with breast cancer, you are at increased risk as well. And there are all sorts of other factors. But I wanted just to throw that out this morning, because not everybody would certainly listen to my program on Wednesday night. But I thought that we'd use this medium to say it's not just Joe Biden. A lot of black men suffer from this too.
And I appreciate you bringing it up. So at what age should men start to go and get checked?
Well, in terms of being a black male, and in terms of if you have a relative who's had cancer before, it differs slightly. But going for a routine exam, I would say if you are a young black male today and you are 30 plus years old, certainly if you're 40 and up, you should be going for prostate cancer. It has started to occur in people less than 40, but it's rising. But the chances are that the test will be normal. And you have to look at the test. If the blood tests come back at like 0.4 and above, therefore, you may need a biopsy. You may need to have it checked out properly. And if it's an aggressive cancer, the next time you check, it may be double that, you know? And so we have to watch these things very carefully. So certainly by the age of 40, men should be doing. If you are a relative of someone who had prostate cancer before, or you have a sister or mother or with breast cancer, do it a little earlier, at the age of 35, 30.
All right. And what does the exam entail? Because I think that there seems to be some phobia amongst men.
To make a diagnosis of prostate cancer, all you need is the blood test. All you need is the blood test. But if the blood test shows unusual thing, to grade it and to stage the problem, we need a digital rectal examination. So we're now settled on that. Black men afraid digital rectal exams. There's some women who are afraid of rectal and vaginal exams too.
Pap smears.
but of course a female, you wouldn't do
not pap smears.
A pap smear is a vaginal exam.
Right.
But sometimes we don't do, we only do rectal on a female, not to check if there's a prostate, but to get stool and so forth, and to if there's piles and we feel it for different things in nature. That's different. But for men, don't be afraid to go and get the blood tests. And if the blood test starts to show something funny, the doctor is then going to recommend an ultrasound and should perform a digital rectal examination as well. But by that time, you are so alert that you're going to allow it. You know what I mean? And not be homophobic, not be afraid of anybody. If you're homophobic, go to a female doctor. Let the female doctor do the exam for you. That might soothe your mind.
And what are some of these signs, all these signs that persons should look out for in the event that they do have prostate cancer?
Well, this again, the normal standard type of prostate cancer, if it is growing close to the tube that runs through the penis, to your pee to run out, and starts to press on that tube, we call that tube the urethra, it will narrow that tube, and you will have funny symptoms. First of all, some frequent urination. When you try to urinate, it starts and stops as if you haven't emptied your bladder, because the thing is retaining some of it. And you have to go like 3-4 times. You ask the question, can you still hit the wall? Can you still hit the wall? The force at which it comes out. There can be other symptoms, but this suggests there's other problem like an infection, such as some pain on urination and so on. You got worried if there's blood, but that will occur a little later on. But there's some aggressive cancers that spread directly to the bone. Prostate cancers love bone, love to spread to bone. So you start to have back pain. They can even spread quickly to the skull, and they go through the bloodstream and lymphatics and things like that, and they can spread very, very quickly to bone. But you're also worried if they start going to the rectum, the intestine, liver, and all them kind of things as well. So depending on how aggressive it is, it could have already spread and caused symptoms. But the standard one is going to cause urinary symptoms, such as difficulty passing your water, the force coming out not being so great, retention of urine in your bladder, so that you keep having to go, you're emptying your bladder properly and things like that.
Okay, and we see like another minute. Treatment. If you're diagnosed, what is the type of treatment that some persons could undergo?
Boy, there are some brand new treatments, and treatments now depend on where you live, which country you live in, and of course how early. So if you are a stage 1, 2, 3 where it hasn't started to spread yet, then there's certain things we can do, and we can put a tube up your penis and scrape out the inside of your prostate, hollow it out. Consider an apple, and you are going in and you're taking the core from the inside and you're leaving the outside of the apple there, but all the inside has been taken out, the pip and all of that thing, or like a pineapple, or you've taken out the inside of the pineapple, but the skin is still there. Consider it like that, and you call it a cystoscopy, or trans prostate urethral cystoscopy, you know, and we can do that. If it is a stage 4 and it has started to spread, or stage 5 or more, it's then going to be more complex than that, and it will involve potentially radiation and chemotherapy. We now have targeted radiation. We don't have that here in St. Vincent. They have it in certain other countries. In Cuba, they're also very good at this. A number of people have gone to Cuba and so forth for this. And it depends on which type of chemotherapy and so forth that's required. So the people who are survivors are people who really are going aggressively at this. Don't sit back and keep your fingers crossed. There is treatment. Prostate cancer generally grows slowly, but they're the aggressive ones, which occur in about 5 to 10% of patients, go fast, and they kill people.
All right. And I know that you're speaking directly to the men, but it's also for us as women to be able to look and to monitor the changes in our partners or our family and friends. All right. I actually had a friend who died from prostate cancer.
But the more important thing, if you're a woman and you have a significant, a father, a brother, quietly, whisperly, you know, ask them, have you gone for that checkup? That's the most important thing.
But it's also to monitor, because sometimes men can be dismissive of the signs that they're going through, the body changes in the body. They might be dismissive. Yeah. So it's also for us as women to know this information and to, you know, sometimes some men need a little bit of coaxing, right? Yeah. So we have to be able to be there to think. This is a little bit close to me because I did have a friend who died from it, and I honestly thought he didn't want to know that he had cancer, but that's another story. So. All right, so this was very informative, and I hope that all men, especially the men, have paid attention, and to the women out there, that this information has also been useful to you so that we can do our part to protect our women, all right? And with that, we are heading out of this segment. At time here in SVG, it is 9:06.
WEFM is SVG.